Good morning, and welcome to this week's episode of Ask Dr. Murphy. I hope everyone is doing well today. My name is Katie Berg, and I'm a research study coordinator here with the Havey Institute. I'll be leading today's discussion. I'd like to welcome and introduce Dr. Robert Murphy. Dr. Murphy, how are you this morning?
Doing well in this dark, stormy morning.
Absolutely. Very rainy here today. Our longtime viewers will remember Dr. Murphy as the executive director of the Havey Institute for Global Health and the John Philip Fair Professor of Infectious Diseases here at Northwestern University's Feinberg School of Medicine. He answers your COVID, infectious disease, and public health questions each week here on the Havey Institute for Global Health's Facebook page. Today, Dr. Murphy will be answering viewer-submitted questions and addressing the latest headlines through today, August 17th. We invite you to submit your questions below, as always, via Facebook at NU Institute for Global Health or by email at globalhealthinstitute@northwestern.edu. I'm going to start with some COVID statistics for the US. Average cases per day is around 10,000, could be higher. We have not received updates since May on those numbers. Average new hospitalizations, 1,474, that's per week. And average COVID deaths per day is 29. New booster proportion is 17%. Dr. Murphy, any reactions?
Well, this is a continued increase in the number of hospitalizations. We have no idea of the number of cases. However, this particular variant that's floating around now is highly, highly contagious, much more contagious than anything else that we've seen. That's why it's the most common now, this EG5 variant. And it's starting to have consequences in a couple areas. One is that the hospitalization rate has gone up. If you look at who's being hospitalized, it's mostly people who are 75 years of age and older. So it's a very, very vulnerable population. But the other group that's getting impacted are very young children. And they're having a disproportionate increase. And the smaller the child, the younger the child, the more difficulty they have handling the infection. They generally are not dying from it, but they're ending up in the hospital. And the reason for those two groups being so vulnerable is that the immunity that they've had from the vaccinations and prior infections is, in the case of the adults, is starting to weaken because of their underlying age and physical state. And so they're just much more vulnerable. And they also have a lot of comorbidities. They have more diseases and everything that we know for a long time make things worse. In the case of the children, these kids are born, they have no immunity, maybe a little bit of passive immunity from the mother's antibodies, but they essentially have no immunity, and the infections are so contagious, they're getting it. So that's what's happening. And vaccination uptake in children, especially young children, is very low. It's really the lowest of any of the age groups. Vaccines are recommended from 6 months of age and older. That will help, of course. They've just adjusted the booster recommendation so that there's fewer booster shots that kids have to take because their immune systems are so young and robust and the like. But that's one thing that people really ought to consider now, if this thing is going to start spinning out of control again.
Absolutely. It's definitely something that we have to keep our eyes on. And speaking of boosters, we received several questions this week surrounding the boosters. So I'm going to try to pack those together because they do have some overlap, but some differences. So first is, can you give us your general recommendation for the upcoming boosters? And second, it's some special cases, people who maybe are at risk for severe COVID or are traveling coming soon. Do you recommend that if they have these bigger events where they might be exposed, they, jump the gun and get another bivalent booster? What are your general recommendations?
Okay. So first of all, The people who have only had COVID in the past and think that they're immune because they've had it in the past, that group does the worst by far. There are multiple studies that document that effect. Those that had the first 2 shots and at least 1 booster before September 2022 do okay, but that's in 2022 is when the bivalent booster came out. That was the one that had the old vaccine plus the Omicron based vaccine, or it contained Omicron activity. So that booster does much better. And then if they had the infection as well, and then got their booster shots, including the one from September 2022 onward, they do the best. And that's the best hybrid immunity, and they are protected the most. And as you mentioned in your comments, everyone is like, they're traveling a lot, they're going here, should I get another booster? If you have not had the bivalent booster, in other words, if you have not had a booster shot since September 2022, came out September 1st, you should get another bivalent booster before you do anything where you're likely to get exposed, which is now happening everywhere. If you've already had that booster, you should wait until the end of September, just 6 weeks from now. The new booster shot will come out, and it's really geared towards these Omicron, including EG5 variants, and will be the best thing for you. Now, if you're going to do something that's going to put you at risk, or you have some underlying medical conditions, and you had the bivalent booster, there's still a couple things you can do. You get on the airplane, you can wear a mask. There are still people that wear, believe it or not, there are still people that wear masks, even including some flight attendants and people at the airport are wearing masks. They see this. So there's passengers and there's crew that are wearing a mask. And I think you're going to see a little bump up in that as well, especially for vulnerable people. And I think people have been pretty respectful of those that wear a mask now. And so you can do that, but then you can also bring some treatment along with you. The Paxlovid is a little box of medication, and you take your pills 3 times twice a day for 5 days, and that will have a very good impact as well, whether you're vaccinated or not. So, and then when you get back at the end of September, go ahead and get that new booster. So that's basically how I've been breaking it down in my recommendations. I know in some places they won't give you another bivalent booster. They won't give you another bivalent booster if they have on record that they already gave you one. I have just heard that. I don't know if that's a uniform thing or not. Remember, these vaccines are paid for by the U.S. government at this point, but that's, of course, also going to end. But but that's really kind of the answer. And it is a very common question. I get that question several times per day.
Absolutely. And in terms of the Paxlovid, we have had some follow-up from people saying that either it wasn't improved for them from their insurance, or they just were unsure of, what route to take to get Paxlovid. Could you just give some general recommendations on those lines?
Well, you have to get it by prescription, and you have to either do a telehealth visit or a visit to a doctor, or go to a clinic and make your case and get the prescription.
Okay, well, thank you for letting us know and letting our viewers know. And again, thank you so much for submitting your questions and for tuning in to Dr. Murphy's segment on WGN. We really appreciate your support, and that will take us into the headlines for the week. The first story that we're talking about was a very, very interesting article that reported on the vaccination effect on inflammatory response following COVID infection. Can you give us some background about what that all means and what the results were?
Yeah, this is scientists are studying the whole response, like why people are getting infected, what happens to them, who gets long COVID, who doesn't get long COVID, all those kind of questions. And this leads into that. So this is a very important paper. It's published in The Lancet, which is one of the top medical journals in the world out of the United Kingdom. And they looked at the immunologic response to in 882 people who got COVID, who were either unvaccinated, partially vaccinated, or fully vaccinated, including with boosters. All right. And they do all these very sophisticated measurements of immunity and immune response. And it was really quite clear that those that were fully vaccinated had much lower levels of these immunologic markers. And these markers are thought to cause all sorts of this reaction, this immunologic reaction, as measured by these markers, are thought to cause a lot of problems in some people and maybe long COVID. So that's kind of the link. Now, they didn't look at long COVID in the study. They're just looking at the markers. So it's more of a scientific-based study, but it does support what we've known in other bigger studies, where we know that long COVID is less in people that are vaccinated, even if they had COVID. So it's a little bit, maybe you have to follow the thread there, but the vaccinated people do better. They don't have this inflammatory response. And in other studies, we've shown these vaccinated people have less long COVID, and long COVID is real and can be very debilitating. And you don't want to get it if you don't have to.
Absolutely. And I feel as though those results really point out the fact of how important it is to stay up to date on those boosters. Even people that were partially vaccinated were not seeing as low of concentrations of these, inflammatory markers as the fully vaccinated people. So that's really important to keep in mind as we have more boosters coming out.
Mm-hmm. Yeah, and this new vaccine should be really great. It's geared towards what's floating around in the world right now.
Mm-hmm. And speaking more about, COVID infection and some of the things that we're seeing come along with that, we saw that there was an increased risk of incident diabetes following a COVID infection, as opposed to COVID vaccination. There was some speculation previously. Can you tell us about the study and what the researchers found?
Yeah, so this is a study looking at the risk for developing diabetes in adults following vaccination or following getting COVID. And it was published in PLOS Medicine, which is a highly respected journal. They looked through the electronic health databases in 325,000 vaccine recipients. And they matched them with 145,000 patients who had COVID and did all the appropriate controls. And they found that the vaccine was not associated at all with developing diabetes. So this is good news. However, having COVID was. Now, whether the COVID caused diabetes or just unearthed it, that it was going to come anyway at some particular point, we don't really know. But that association is not good. Especially, they have a nice comparison in these hundreds of thousands of patients comparing vaccine versus disease. And so just another reason to get vaccinated.
Absolutely. And our last story today is taking a little bit of a shift away from COVID. I recently saw some news out of the East Coast of the United States that 3 people have passed away after some sort of rare infection. Can you give us a little bit of insight onto what that is and what tragically happened to these people?
Yeah, this was reported on CNN yesterday and various other news outlets. 3 people, 2 from Connecticut and 1 from New York, died from Vibrio vulnificus. Sounds bad, and it is bad. It's related to cholera, but it's a different species, and it's common. 80,000 people per year get it, and about 100 people die in the United States from this flesh-eating disease. And it's notoriously found in oysters and also in warm, salty waters. So 2 of the patients from Connecticut were swimming on Long Island. They were aged 60 to 80 years of age. They got it. It's also very typically somebody has an open wound, a cut or something on the leg or feet, and they're in the water. And that's how it gets in. And one person from New York definitely got it from eating oysters. Now remember, oysters you eat them raw. You actually eat them alive. And they're great. There's people eat them year round now. But for those of you who've been eating oysters for a long time, you may remember, the old saying, don't eat oysters if there's not an R in the month. So you're only supposed to eat them from September to April. Now that's been debunked because nowadays we know how to store and ship oysters safely. But there's still been cases of this, especially in the summertime. So it's associated with heat. Now, there's an upcoming big oyster festival in Connecticut. And of course, since 3 people are dead and 2 of them from Connecticut, although they were swimming in New York, there's a lot of nervousness about it. And the Connecticut put in, they had the last outbreak they had was about 10 years ago. And they put in, for the oyster fishermen there, a set of rules and regulations on how to store the oysters after they're taken from the oyster beds. So they haven't really had any problems for 10 years, and now all of a sudden we've got the 1 case plus the 2 in the water, and it's the temperature that is the key, and the oceans are a little bit warmer. And there were cases even reported up in Nova Scotia earlier this year, and we've really got to be cautious about this. So oysters are really not that big here in the Midwest. I mean, people do eat them. There's oyster houses and whatever, but on the East Coast, people eat a lot of them. And they like to eat them in the summertime because they're kept cold, and everyone, it's just a delicacy, I guess. We've got to really be careful and follow this very closely, which it is. But just remember, it can be lethal if you get it. If you've got some open wounds and stuff, probably you should be staying out of you should not be going in the ocean, because this is going to be a risk for you. Now, we're only talking about 3 people, but we've still got a couple really good warm weeks of summer left, and people are going to be eating oysters and going in the ocean and whatever. And we've really got to be vigilant about it. I think there's going to be, because of this, there's going to be a downtick in people ordering and eating oysters, and this festival coming up. I don't know, it's probably going to have some kind of impact. But keep in mind, just be careful, particularly if you're immunocompromised or you have any open sores or anything, about going in warm, salty water. Everyone wants to go in the water. It's warm now. Finally the ocean got warm enough to go swimming, but now you're at a slightly increased risk. So it's that's the story on Vibrio vulnificus.
And a somber note to end on, but we thank you once again and every week for your expertise and time in answering questions and reacting to these latest headlines. We'll absolutely keep an eye on these stories to see if they further develop. Thank you, Dr. Murphy.
Great. Have a great weekend.
Thank you. And thank you to all of our viewers for joining us once again this week. We again invite you to submit any questions you have down below via Facebook at NU Institute for Global Health, or via email at globalhealthinstitute@northwestern.edu. Thank you.